Dealing with persistent vulvar pain, it can be so confusing and honestly, really isolating. So many women suffer in silence, not sure what's going on or who to even ask for help. Today, we're going to talk about this condition, vulvodynia, and most importantly, explore a real path toward relief and healing.
So, does this sound familiar? If you're here, there's a good chance that question really hits home. Maybe you felt dismissed or been told it's all in your head. Well, I want you to know what you're feeling is absolutely real and you are definitely not alone.
Let's start with what is probably the most important message of all. This is a valid, recognized medical condition. It is not just a psychological issue. Really letting that sink in, that validation is the very first step on the journey from pain to feeling like yourself again.
All right, so what are we actually talking about here? What exactly is vulvodynia? Getting a clear understanding is, for sure, the first step to managing it effectively.
To put it simply, vulvodynia is the name we use for persistent vulvar pain when all the other things, like infections or skin conditions, have been ruled out. It can be frustrating to hear we can't find a cause, but it's important to understand that the pain itself is the condition.
Now, everyone's experience can be a little different, but these are some of the most common symptoms you might recognize. It could be a constant burning or stinging, or just a raw, irritated feeling. For a lot of women, the pain is brought on by touch, which can make things like intimacy, wearing jeans, or even just sitting down really, really difficult. And part of what makes vulvodynia so frustrating is that there's no single simple cause. It's usually a pretty complex puzzle, a combination of different factors all coming together, which is why a one-size-fits-all diagnosis just doesn't work. And this really shows you what we mean. For instance, the pain might be coming from nerves in the area that have just become way too sensitive. Or it could be tied to tension in your pelvic floor muscles that you don't even realize is there. Hormonal shifts, a history of infections, all of these things can play a role. Okay, so after hearing all that, you might be thinking, wow, that's a lot. Is there any good news here? And the answer is a huge yes. There is a highly effective, evidence-based treatment, so let's talk about how physiotherapy can offer a clear path to getting better. Pelvic floor physiotherapy is really considered one of the absolute best treatments for vulvodynia. And it's not just about covering up symptoms. It's a specialized therapy designed to get to the root of the problem by looking at the muscles and nerves of your pelvic health. So what does this actually look like? Well, a physiotherapist will create a plan that's completely customized for you. We often start with teaching you how to relax those tight pelvic floor muscles. We might use something called biofeedback to help you reconnect with and control those muscles. Then we use gentle techniques to help calm down those sensitive nerves. And maybe most importantly, we give you the education you need to manage this for the long term. This is such a key part of how we look at healing. See, chronic pain is never just physical, right? It affects our stress levels, our relationships, our mood. This approach simply acknowledges that. And it means we treat the whole person, your body and your mind, to help you get a much more complete and lasting recovery. So we've talked about what the problem is and how physiotherapy can help. Now let's talk about finding the right person to help you, because the who is just as important as the treatment itself. At OVA Women's Health, we've been so privileged to help over 2,000 women find relief. So many came to us feeling hopeless, and there is nothing better than seeing them reclaim their lives from pain. This isn't just a number to us. It represents a whole community of women who are now feeling so much better. We have this philosophy that's pretty simple. We want to work ourselves out of a job. Our real goal isn't to see you forever. It's to give you the tools, the knowledge, and the support you need to heal so that you can gain your independence back and find relief that truly lasts. So our care is really built around you. Pelvic pain is what we do. It's our focus. Every single session is one-on-one in a private, safe space. We use techniques that are backed by science, and we make sure you understand what's happening in your body. And really importantly, you don't need a doctor's referral to come see us and start your healing journey. Look, if you remember just one thing from all of this, please let it be this. You do not have to go through this by yourself. And with the right care and support, healing is absolutely 100% possible. Taking that first step is often the hardest part, but it's also the most important. If you feel like you're ready to start, we are right here, ready to support you. Go ahead and grab your phone and just scan this code. It'll take you right to our website where you can find out more or even book your first appointment. Thank you so much for listening, and please remember, a future with less pain is truly within your reach.